Dr. Jeff Harp from Highland Family Medicine is back with us. Doctor, good to see you.
Likewise.
A week ago, we talked about coronavirus. We are talking about it again. There continues to be developments as it relates to this COVID-19 disease, and I think a lot of concern and perhaps even some confusion on the part of people as well. So let's break this down. When we say COVID-19 disease, what is this? So
COVID-19 disease is the illness caused by the newest coronavirus that we are aware of causing serious illness, SARS coronavirus 2. So COVID-19 is the disease that it causes. And coronaviruses are all over the place. There's lots of them. They cause colds most of the time, but occasionally one comes along, a new mutation that is a very serious illness, and this one is a serious illness.
Everyone I run into is talking about this. It's on their mind. Just how serious is it?
Well, we don't really understand yet because we're learning, and the Center for Disease Control in the U.S., for example, is investigating the virus, the whole disease as it develops. But currently, it looks like the fatality rate, in other words, of the people who are infected, 2% or less actually die from it. 20% are seriously ill. Up to 80%, though, don't have any symptoms at all. So that's the trouble. We don't know how many people are out there without symptoms. So those people obviously are not seriously affected. So probably the mortality rate will be less than 2% when we figure it out.
Okay. We hear about people being isolated, being put into quarantine. Help us understand, what does that mean?
So isolation is for someone who is known to have the disease or is very likely to have the disease. And they are asked to be away from other people until their symptoms resolve. Quarantine is different. That's someone who has likely been exposed to disease, and they are kept away from other people until the disease would have developed. So up to 14 days away from other people to make sure that they're not getting the disease.
And all of this sort of falls under the umbrella of the public health response.
That's right.
How are people tested for coronavirus?
The CDC actually distributed testing kits to I think about 100 places in the United States. So in our state, it's through the county and health state departments. So if a person thinks that they've been exposed, first of all, exposed to someone with the disease and then have symptoms, they should contact their primary care health provider, who would then get them in contact with the proper place to get testing if they thought that was necessary.
All right, one more point before we go. Masks are flying off the shelves these days. Again, this is part of people trying to kind of get their arms around this. Is there any legitimacy to using a mask to try to ward off this COVID-19 disease?
Currently not. There's no recommendation for masks unless a person actually has the disease or is working with someone who has the disease. The thing that's recommended is the usual measures: washing hands, not touching your nose and your mouth when you're ill, and not exposing other people or yourself to other people who have major symptoms.
All right. As always, we appreciate the update, Doctor. Thank you.
Sure.
We'll add this online, and when we do, we'll have a couple of links for more information about this COVID-19 disease as well. You'll find it, as always, posted at rochesterfirst.com.